We're going to be speaking to Dr. Bogoch right now for a check of everything related to health and infectious diseases. Dr. Bogoch, great to see you. You're always in a different setting, so I know you're busy this time of year. I want to start by asking you about RFK Jr.'s appointment as Secretary of Health and Human Services. How might this influence vaccine policies going forward, the CDC's response to infectious diseases, and even the FDA's drug approval process? And why should Canada and really the rest of the world care so much about this?
Yeah, I mean, great question and great point. I think there's just a lot of uncertainty. We don't know what the United States is going to do. We don't know exactly what their shift in leadership is going to look like exactly. And quite frankly, while they do set the tone for much of the world, they're not the only voice. And of course, we have Canadian voices, Canadian leadership, and other leadership around the world. I think at a fundamental level and really looking at basic principles, we've got to stick to fundamental principles of science, of open-mindedness, of data, of common sense, and really ensure that we are able to provide meaningful information to Canadians, but also to the rest of the world. This is an incredible opportunity for Canada to step up on the world stage and be a true leader and a major voice in good quality data to come out with vaccine policy, public health policy, and I think I see these as opportunities for Canada to lead.
Yeah, and although infectious diseases can spread, if we get protected ourselves, at least it won't affect many of us here. Let's stay on with that, because you wrote on X about a massive measles outbreak in Texas more than a week ago, 48 cases in those unvaccinated or whose status we don't know about. And we're certainly seeing cases of measles popping up on our side of the border, too. Thankfully, not as big yet. But, given RFK's anti-vaccine stance and really this decline in vaccinations post-pandemic, do you think that we'll be seeing more outbreaks like this? And if so, I mean, how dangerous is this down the road?
Yeah, we most certainly will be. We already are. I mean, this is really awful to see. And this resurgence of measles is a global phenomenon. It's not just in the United States or Texas. This is a large global phenomenon. And to your point, exactly. We are seeing this in Canada as well. We've seen a big outbreak, for example, very recently in New Brunswick, Quebec, and Ontario. And this is still ongoing. Yes, there is a large outbreak in Texas, but, for lack of a better word, we're not immune to this either. I mean, we have the same issues here as there are elsewhere in the world with hesitancy towards vaccination. And I think we have to combat this in several different ways. The first, obviously, is to lower barriers to vaccine. Not everyone who isn't vaccinated is, skeptical or going to be considered, as some people paint, an anti-vaxxer. Some people would completely get these vaccines. We just need to lower barriers to them and provide them with credible information, good quality information, and ensure it's easy for them to get, so that when they're offered these vaccines, for example, measles, mumps, rubella, routine childhood immunizations, they take them. But to the other point as well, we know that there's misinformation and disinformation that's often amplified in online settings. It has real world consequences. People are choosing not to vaccinate themselves or their family members. And that's a problem. And I think we really need to step up and address this head on. And again, it's really enabling people to make smart decisions for themselves by providing them with credible, high-quality information from high-caliber people who are trusted. And it takes a lot of time to build back public trust in public health, but that's a path definitely worth taking.
Yeah, absolutely. I wanted to get into, the federal government being proactive with the avian flu kind of vaccine with humans, but we'll have to save that for another time. Dr. Bogoch, really appreciate your time and your insight. Have a great week, and we'll chat again soon.